Principally, the forum next week in Addis is going to be the largest, highest level meeting of public and private sector leaders focused on health that's taking place in Africa. And on the back of this forum, we will be launching the Africa Business Coalition on Health, which is a private sector-led coalition of companies and philanthropists who will come together to positively affect health outcomes. And one thing we'll be discussing is quite a powerful report that's jointly issued by GBC-Health as the Aliko Dangote Foundation and United Nations Economic Commission for Africa on the state of health in Africa.
Health is obviously a very important topic, and I recall that in a recent interview you indicated that advanced countries had built their capacities to solve their health problems, and it's time for Africa to do the same. Now, practically speaking, how does GBC-Health support the efforts to build capacity to address the health issues in Nigeria? I
mean, one simple and straightforward example, which rests on the notion of charity begins at home, is that if you think about the private sector, it's the largest employer. It's the largest employer of people in an organized way in Africa, okay? And literally hundreds of millions of Africans are influenced by what private sector organizations do. So what we found in North America, in Europe, and in Asia is the concept of workplace practices as a way of influencing people to act in a way that would lead to better health outcomes. Now, the problem, of course, is that companies must know what to tell people, how to influence its own employees, and who will, in turn, go home, okay, apply this to their children, apply this to their neighbors, and to their areas of influence. So I'll give you a simple example. Do you know about what to do to avoid HIV?
A little bit, yes.
And I'm sure you would know a lot better and a lot more if you were exposed to good practices, etc. And so what we aim to do is take our members, okay, and literally train our members on workplace practices around issues such as communicable and non-communicable disease, healthy lifestyles, good diets, treatments, etc. And you can't imagine that prevention is the best means of health improvements. And that's just at the low-hanging fruit level. But look, if you think about GBC-Health, the Global Business Coalition for Health, which has formed the template for what the Africa Business Coalition will be doing, just focused on Africa. And one of the first things I learned when I joined GBC, the board of GBC-Health many years ago, was I was introduced to this company called Marathon Oil. And very passionate CEO, and I said, okay, what are you doing in the area of health? And he says, well, we want to eradicate malaria in Equatorial Guinea. I said, no, come on. And he says, no, we're serious about that. And they started with an island with a significant population. And I mean, they dealt with malaria in that island and extending it, and this is one oil company, okay? Now, I did look at their budgets, and these are programs that have lasted, I think, well over 10 years, maybe going on to 15 years, and $100 million. I know many African countries that many African companies that can, commit $100 million over 10 years to fix a problem. And I know of hundreds of companies. So if you think about the fact that through this coalition, through the African Business Coalition for Health, we can actually get, from a program perspective, actually get African companies committing to programs based on expert advice, okay, and building their own capacity to ensure that these programs are properly implemented, we can really shift the needle.
Right. But help us appreciate what this Africa Business Coalition seeks to achieve and exactly how it works. So is it a coalition of businesses, a coalition of philanthropists, or a bit of both?
Okay, we are benchmarking the origins of our coalition around the origins of the Global Business Coalition for Health. And it's also no mistake that we are launching at the AU, okay? So the UN, all right, when the AIDS epidemic first raised its head. And you know that whilst Africa carries a huge burden, all right, initially, actually, this was something that shocked the advanced world, okay? Because they had the first challenges of HIV/AIDS. And so people are beginning to die of a strange disease that nobody really gets their head around. Fear, you know, unreasonable responses and so on. And so, you know, they wanted to form a broad-based coalition of nations to fight this pandemic, okay? And they realized that whilst governments, you know, in advanced countries had large budgets and capacity, they needed the private sector, because the private sector as a collaborator on major issues like this, okay, is a very powerful ally to have. And so the UN Secretary General put together, there's this gentleman, he's late now, Ambassador Holbrooke, okay, and he was the first CEO, if you like, of GBC-Health, okay? And it was his job to go around the private sector, to go around philanthropists, okay, to bring on board Chevron, Shell, you know, great men like Ted Turner, you know, George Soros, and so on. And this coalition was formed. And from this coalition, you know, Marathon Oil in Africa, you know, you have the Red Campaign, things that we have seen today, and, you know, you had the airline tax. You may not know this, but in Europe, there was, I'm not sure if it still operates, but for continental flights, okay, the European airlines had a little tax, okay, on all tickets, which was, you know, also in turn, I think, sent to the Global Fund. So you think about these initiatives and...
So it's primarily businesses?
Yeah, it's businesses.
It's a coalition of businesses.
Yes.
Okay, but for this to thrive in Africa, I think the big question is, do we have the political will to back it up? From your interaction with African leaders, do you get the sense that that political will is there? Because when you take a look at the budgets of African countries, many will suggest that healthcare is not necessarily a big priority. Maybe because there are other priorities, but at the end of the day, that is what the numbers are telling us. But do you get the sense that it's a shift now?
You've said, I won't say you've said it all, but you've hit the nail on the head, certainly, in the sense that, you know, we say that you know what's important to a human being by where they spend their money. Sure. So if health is important, certainly we'll be spending a lot more, okay, and closer to the 15% of budgetary expenditure that at the minimum is expected of nations.